The liver is the primary filter between blood returning from the digestive tract, which can carry nutrients, minerals, amino acids, drugs, and anything else we consume, and the systemic circulation. So, what happens when this filter is obstructed? Blood is supplied to the digestive system from three branches of the abdominal aorta: the celiac trunk, and the superior and inferior mesenteric arteries. Various substances enter the bloodstream through the GI epithelium. Then, from the lower esophagus to the upper colon, blood drains from the digestive tract into the splenic, gastric, and mesenteric veins, all of which combine to form a single hepatic portal vein that goes to the liver. The functional unit of the liver is the hepatic globule. Here, blood flows from small branches of the hepatic portal vein through sinusoids lined with hepatocytes. These specialized cells detoxify blood as it passes to the central vein in each lobule before returning to systemic circulation via the hepatic vein. Portal hypertension refers to increased hydrostatic pressure in the hepatic portal vein and is typically caused by changes within the liver itself. These changes may include blood clots, tumors, and parasitic infections. But in Western countries, cirrhosis is the condition most commonly associated with portal hypertension. Cirrhosis refers to widespread scarring of the liver and can be caused by long-term alcohol abuse, viruses such as hepatitis C and B, certain drugs, advanced fatty liver disease, or excess iron intake. Around a liter of blood flows into the liver from the portal vein every minute. As pressure increases, blood flow is rerouted to areas of anastomosis between the systemic and portal circulatory systems, which can lead to varices, or distended vessels that can easily rupture and cause excessive bleeding. Varices occur most often at the lower esophagus, rectum, and umbilicus. Without the detoxifying effects of the liver, blood that circulates back to the body contains nitrogenous waste products, primarily ammonia. These substances pass into the brain, resulting in hepatic encephalopathy, altered consciousness, changes in mood and personality, mobility issues, and in some cases, coma. Portal hypertension also causes increased pressure in the splenic vein. While not as likely to rupture, this backup causes splenomegaly, leading to a reduction in blood components including red blood cells, which causes anemia, white blood cells, leading to increased risk of infection, and platelets, which can exacerbate any bleeding. The increased pressure in hepatic sinusoids and the splanchnic bed also leads to ascites, or excess fluid in the peritoneal cavity. Treatments for portal hypertension vary depending on the underlying cause. Some conditions, such as schistosomiasis, can be cured with drugs, while others, like cirrhosis, are indicative of end-stage liver disease and require a liver transplant. More often, the goal of therapy is to manage the sequelae, the effects of portal hypertension. Varices can be treated endoscopically, either by banding or injection of a sclerosing agent. Hepatic encephalopathy is treated pharmaceutically by lactulose, which draws ammonia into the large intestine so that it can be excreted in stool. Ascites is managed by dietary restrictions and medications, and severe cases can be treated with paracentesis, the drainage of excess fluid using a sterile needle inserted into the peritoneal cavity. Beta blockers are used to increase vasoconstriction in the gut, thus reducing splanchnic bed outflow and decreasing pressure in the portal vein. For severe portal hypertension, a transjugular intrahepatic portosystemic shunt, or TIPS procedure, can relieve pressure. This procedure involves forming a mesh-enforced channel within the liver to allow blood to return to the systemic circulation via the hepatic vein. As with the other collateral pathways, blood that hasn't been filtered by the liver can carry ammonia and other toxins, and hepatic encephalopathy is a significant post-treatment risk. In short, the hepatic portal system routes blood from the digestive tract through the liver to protect our bodies from any dangerous substances that may be absorbed by the intestines. Increased pressure in the portal vein can lead to life-threatening varices, hepatic encephalopathy, splenomegaly, and ascites. Various medical interventions can help manage these symptoms, and a shunt can relieve pressure in the portal vein, but for certain underlying conditions like cirrhosis, a liver transplant is the only long-term treatment for portal hypertension, underscoring the importance of addressing lifestyle choices that may lead to severe and irreversible liver damage.